Hope you all are doing well and enjoying the expo so far. We want to welcome you to the AKA Foundation It's About You Health and Wellness Expo. Again, here today we have hair extraordinaire, skin extraordinaire, Dr. Claire Hollins. She is a dermatologist and an assistant professor in the Department of Dermatology at Penn State Health. She is also the founder and director of the Skin of Color Clinic, and that is also located at Penn State Health. So please feel free to ask your questions if you're curious about anything, if you want to know something, whether it's skin, hair related, specifically around women of color or people of color. She is here to be your expert in that subject matter. So if you could give a very warm welcome to Dr. Claire Hollins.
Oh, thank you. Hi, guys. Thanks for being here. Looks like we have about 25 minutes, so I was going to talk a little bit about some info, then open it up for questions. So there was a couple things that I wanted to make sure you guys took away from today. We will talk about hair in a moment, but I also want to talk about life-threatening stuff. So everybody know that Black people can get skin cancer? Does everybody know that? Yes, we absolutely can. It's very rare, so I'm not too terribly worried about it, but it can happen. It's what killed Bob Marley. I think a lot of people do know that. So where we tend to get our skin cancer, if you're going to get it, even though it's super rare, it's very, very rare, like 1 in a million, literally 1 in a million for us. So there's about 45 million Black people in the country. So about 45 people. That's not a lot, but still, you don't want it to be you. You don't want it to be your mom. You don't want it to be your uncle. So where do we look? Palms and soles, packaged with gold writing on it. And that is, it's got more moisturizers in it because a lot of those anti-dandruff shampoos are really drying for our scalp and our hair. So you can get that over the counter. So if you're having flakes, if you're like always just getting like gunk and crust and flakes, it's very common. A lot of people have dandruff. We just need to treat it, not with an oil, not with a grease, but with an anti-dandruff shampoo because we have to treat the fungus that's on our scalp. Everybody has the fungus on our scalp. You are not dirty. It's not that. It's just everybody has the fungus on our scalp. And you just have to get the fungus back under control. We all have it. It's normal on your skin. It sometimes just gets it starts to grow too much, especially if you're not washing your hair very frequently. So try an anti-dandruff shampoo. You want to put it on your scalp. You want to let it sit 5-10 minutes. 10 minutes if you're not washing your hair as frequently, 5 minutes if you're doing it more regularly. And then you can rinse it out and then you can do your normal routine because anti-dandruff shampoo is not really for your strands. That's why another kind of misleading advertising. It's just for your scalp. You're trying to treat the flakes. So you put the shampoo on your scalp or the conditioner on your scalp. Let it sit on your scalp. Rinse it and then do your normal shampoo, condition, and a leave-in treatment after you get out with some oil. I think a little bit of oil on your hair is fine. So that was what I wanted to say about the itching. So just remember, if you've got flakes, you need to treat the underlying issue, which is the dandruff. You treat that with an anti-dandruff shampoo. Don't wash your hair with it. Get it on your scalp. I literally part because I have dandruff too. I part my scalp, I squeeze it on, I go all the way around, and then I go like that, just kind of let it sit, do something, scroll a little bit, and then I rinse it out and do my normal routine. Hair loss, last thing, and then I think I'll open it up for questions after hair loss. So we know we have a lot of hair loss. I talked about one of the reasons. We don't maybe wash our hair as frequently as we should. 1 to 2 weeks, I think, is good. After that, you start to get buildup, you start to get breakage because you're scratching. So we want to minimize that. We want to minimize why things itch. So dirt can do it, because we're not washing enough, or you have dandruff, which is very, very common. So you need to treat the underlying issue with the anti-dandruff shampoo. But sometimes we have hair loss from the styling that we do. So, when we do tight braids, do you have to take a pain pill when you go get your hair done? If you do, that is the sound of your hair follicles under stress. So I don't want hairstyles to ever be painful. If your hairstyle is painful, even if it's the first 1 to 2 or 3 days, it's not good for your hair. It's not good for your hair because you're pulling on these little tiny strands and they can't take that pressure. And what's going to happen? They're going to fall out. And so you're going to have like a little bit, you're probably going to have your baby hair. Then you're going to have loss. And then you're going to have the rest of your hair behind it. And a lot of times that's from the styling that we do. Again, that's another cultural thing. Like it's not wrong to wear your hair in braids. That's okay. But if you do it chronically, repeatedly, that hair is going to come out. And I can get it back, or you can get it back if you stop that styling and you space out when you're doing those stylings. But the problem comes in is that we're like, ooh, I gotta cover that up. So we put it like maybe put a glue in or put it in a lace front. And then that's also pressure on that scalp. And so it's like a big circle of loss. And so a lot of times women will come in to me and I don't want to say it's too late. I'm a very hopeful person, and we can do a lot, but the point is, when you start seeing loss here, you need to start babying that hair. So leaving it out, wearing your hair natural if you can. I know it's hard sometimes because we're so used to wearing it straight or having it in a weave or having it in a sew-in, having it in braids. It's cultural, but it's also very damaging to our scalps. So that's what we call traction alopecia. So alopecia just means hair loss. That's another thing I want to say. Alopecia is just a fancy word for hair loss. So if somebody says, I have alopecia, my natural next question is what type? So this type up here from styling, if your hair is your hairline's going back and back, that's traction alopecia. Too much traction on the hair follicles. And over time, those hair follicles, they can't handle it and they come out. And that can lead to scarring where I can't get the hair back. If you stop, you can get the hair back. You can baby it. You can use Rogaine over the counter and you can get that hair back. And the only other type of hair loss I want to talk about, and then we'll open it up for questions, is the type that's in the center of the scalp. You guys might have heard of it, cicatricial alopecia. Some of y'all are nodding. Cicatricial alopecia, CCCA, if y'all have heard of that. So central cicatricial alopecia, central centrifugal cicatricial alopecia. It's a mouthful, I know. But if we break it down, we'll hear what it means and then we'll talk about it if you guys have questions. So central, usually it's in the center of the scalp. This is hair loss. Thin, breakage in the center. If you just can't get your hair to grow in one little area, that's the beginning of a type of scarring hair loss. So that's the central part. The next word is centrifugal. That just means radiating outward. So in the middle of your scalp, the hair loss radiates outward slowly over time. That's centrifugal. Cicatricial is just a fancy word for scarring. So hair loss in the center that radiates outward and scars, alopecia hair loss. That's all CCCA is. So are there signs and symptoms? Sometimes. Tingling, burning, feeling like somebody's like pulling in the middle of your scalp, that's an early sign. If you know about it and you can, if you feel that, you can stop that hair loss before it happens. So sometimes people will come in and it's completely bald there, shiny and bald. That's harder to get that hair back. You might have to start thinking about a hair transplant. But if you have early signs of it, just some breakage. So a lot of my patients come in and it's just broken right in the middle of their scalp where my ball is. It's just broken off. If you just have a breakage right now, it just won't grow. Growing everywhere else, just not right in the middle. Early scarring hair loss, which means if it's early, that means we can reverse it. So it's not all hope is not lost. So those are the things I wanted to talk about. Traction is up here. If it hurts when you get your hair done, that's not a good thing. We want to make sure it's loose. If you still want to do braids, I'm cool with that. I'm not telling you not to get braids. I'm just telling you space out how often you get it. If you need it to look tight so it can look nice and neat, that's okay. But do it once or twice a year, not every month or every 6 weeks or whatever. So be aware of that. And also wearing hair bands. A lot of women will just start covering that area because it's gone already. And they're like, okay, it's been gone for decades. I can't get it back. They start putting on like a little sweatband. And then that's also going to rub away your hair. So that area really needs to breathe. It needs to just be kind of almost left alone and babied. But a lot of times people cover it and that covering also rubs your hair off. So it's like that's what I mean about the circle. And then we talked about the hair loss in the middle. So that's if you have breakage in the middle, tingling, burning, anything like that, that's early sign of hair loss. And then just recapping, I think that's all I wanted to say about that. Oh, yes, and then the dandruff. Make sure you're treating the underlying issue. Don't cover flakes with grease. You cover it with anti-dandruff shampoo. And if you use that as often enough as you need to, you will get that dandruff under control, which means less itching, which means less flakes. And that means a more healthy scalp. So try to wash your hair every 1 to 2 weeks. So that's what I wanted to tell you guys. I think we have time for questions now, if anybody has any questions.
If anyone has any questions, I will come to you. Please raise your hand. I'll bring you the microphone.
Good afternoon and good morning. Can alopecia be caused by hormones? Because I suffered from alopecia when I was pregnant with my daughter. And then I had it to where it was as smooth as the palm of my hand. But after I had my daughter, my hair grew back like little peach fuzz. But it eventually grew back. So could it be caused from hormones?
Yeah, absolutely. So that's another type of alopecia. We call it telogen effluvium. Sorry, we got fancy words. I don't know why we have so many words like that. But basically, telogen effluvium is a hormone or stress-induced hair loss. I'm glad you brought that up. So stress can make your hair fall out. Absolutely. Usually it's a major stressor. So when I say stress, could it be emotional? Yes. But it's also hormones. Like you said, it can be medication. It can be a car wreck. It can be a death in the family. It could be a surgery. So any type of stress on the body, mental or physical or emotional, about 3 months later, all your hair just sheds, like just clumps coming out. Yes, that is a very common type of hair loss called telogen effluvium. But the good news with that one is it's not scarring. So after your body kind of adjusts and gets over the stress, so to speak, your hair will grow back, just like you said. So yep, that is a type of hair loss called telogen effluvium. It's scary because you're losing, and it's just crazy. If that happens to you, be like, okay, what happened? So it's October. What happened over the summer that was stressful? Did I get into a car wreck? Did I have a surgery? Did somebody pass away unexpectedly? You can probably link it to that, but once you pinpoint it, then you know that your hair is going to grow back. It's not permanent. I think they're preying on our beauty standards. You know, we want to have straight hair, you know, because everybody else in the world does. It's like we don't want to be, you know, different sometimes. I think it's changing. A lot of us are embracing our natural hair, and if you're not there, that's okay too. But the Brazilian blowout, it's very dangerous. So that one is dangerous for sure. And I agree with you. Like I was telling Miss Marsh that I'll go straight sometimes. Like my picture in the thing is my hair straight there, but it does. When you wear your hair natural, you have more body. I kind of like it. You know, it fills out the holes. Because I also have a female pattern hair loss, just hair loss with aging. Sorry, I started. And Rogaine works for all of us. That's not just for other folks either. Rogaine works beautifully. I love Rogaine. You just have to do it every day. That's the annoying part. But we do have it by mouth. If you want to get it from a dermatologist or your primary doctor, you can take it by mouth as a pill. Way easier. But the topical, if y'all have some early traction, go get Rogaine. That's a brand. You don't have to get that. You can get the generic. The generic is fine. And put it on there every day. Your hair will grow back if you catch it early enough. I think I saw another hand.